today I'll be presenting on the effect of varying sampling fraction on estimate precision and computation time within the trusted research environment. These are the preliminary results from the project CCU 002 and 205, and I'm presenting on behalf of this team. This project is has used the data and analysis framework, which was used by the CCU 002 vaccine analysis. The analysis looked at association of COVID-19 vaccines with the major venous, arterial, and thrombocytopenic events. And this analysis used a Cox proportional hazard model to estimate hazard ratios for periods of after vaccination compared with the pre-vaccinated or unvaccinated person time. These models used data from all people with the outcome of interest and 10% random sample of people without the outcome of interest. This was done for the computational efficiency. And to account for this sampling of non-case population, the analysis incorporated inverse probability weightage. It's a method to recreate the analysis on the whole population by introducing weightage appropriate to the according to the sampling probability of each individual. And the confidence interval was derived using a robust standard error. In this particular analysis, we chose pulmonary embolism and portal vein thrombosis as representative events for common and rare event. And we planned to repeat this analysis on varying sampling fractions. And we decided to create 50 separate random data sets for each sampling fraction, except for the 50% sampling and 20% sampling, where we limited it to 5 distinct random samples. We estimated change in variance, standard error, and computational time for varying sampling fraction. And we also investigated the change in standard error from this model with the change in control to case ratio. This table here we represent the hazard ratio and 95% confidence interval for different period, like week 1 to 4 and week 5 to 39 after vaccination, compared to the pre-vaccinated or unvaccinated time period. Unadjusted, age-sex adjusted, and maximal adjusted models were run separately for the different age group, less than 70 and greater than or equal to 70 years. And the model was also run for overall and male and female population. And here we are presenting the hazard ratio and confidence interval for the various sampling fraction. And this is for the effect after exposure to the COVID vaccine developed by AstraZeneca. Here we can see that the hazard ratio and 95% confidence interval are almost identical for the different sampling fraction from 50% to 0.1% sample. And the lower sampling fraction had a slightly different confidence interval. However, the change was on the second decimal space. And the similar trend we can see on the effect after the vaccine developed by Pfizer, after exposure to the vaccine developed by Pfizer. This table gives the time taken for the completing a single set of analysis. A single set of analysis comprises the estimating hazard ratio for week 1 to 4 and week 5 to 39 after vaccination, comparing with the unvaccinated and pre-vaccinated time period. And each analysis was done for both the vaccines, and the analysis separate models were fit for the different age group and also for overall and male and female separately. So as we can see that when the sampling fraction is going up, the time taken for completing the analysis also increases. This is time in minutes. And also once the adjusted models were taking slightly longer time than unadjusted models. However, we can see that once the sampling fraction is going below 1%, there is hardly any advantage in terms of computational time. And we also investigated at the change in what drives the change in the standard error. And we plotted the ratio of standard error to the standard error of 20% sampling. And on the x-axis, it is the control to case ratio. Here, for the common, the upper panels represent the effect on the common outcome, whereas the lower panels represent the results of analysis done for the rare outcome. Here we can see as the case to control ratio goes from 1 to 10, that standard error improves, and there is hardly any improvement in standard error after the case to control to case ratio is going above 10. In regards to the analysis for the rarer outcome, it was we are still proceeding to a lower sampling fraction to bring the control to case ratio closer to 10, and we are expecting a similar other relation as we have seen in the common outcome. From the available results, to summarize the finding, the hazard ratio estimates and the 95% confidence interval didn't vary considerably from 50% sampling to 0.1% sampling. Lower sampling fraction takes lesser time to run, but with the diminishing returns for very low sampling fractions. The variation in standard error is driven by control to case ratio in each analysis, and there is no detectable gain in precision once the ratio goes beyond 10. So as every other project, this is also a collaborative effort from different institutions within the consortium. I'd like to extend our thanks to all those who are for their valuable inputs and continuous support.